Latinos in the United States face many health challenges influenced by socioeconomic status, language barriers, and limited access to health care. That's why we're so excited to bring this particular First Friday discussion on health in the Latino community. I'm Loraine Ballard Morrill. I'm Director of News and Community Affairs for iHeartMedia Philadelphia. I am joined by my colleague, Jose Urdaneta, producer and air personality for the Enrique Santos Show.
Gracias, Loraine. Y hoy vamos a estar hablando acerca del acceso al sistema de salud y la salud de los latinos aquí en los Estados Unidos, considerando los desafíos que ellos tienen.
So we have some extraordinary guests joining us here today. Dr. Nuria Lopez-Pajares, Independence Blue Cross Medical Director and Board-Certified Preventive Medicine Physician for Independence Blue Cross. Jamile Tellez Lieberman, she is Senior Vice President for Community Engagement, Research and Health Equity for Esperanza. So let's begin with our first question, which is, Latinos face poorer health outcomes compared to non-Hispanic whites. For instance, they are at a 66% greater risk for developing type 2 diabetes and often have worse outcomes once diagnosed. So what are some of the factors influencing all of this? Jamile?
So I'm going to answer this a little bit from the public health perspective. I'm not a clinician or practitioner. I'm going to let Dr. Nuria sort of speak to that. But one thing that comes to my mind is access of preventative care, like screenings. So I think that many times the Latino community is not able or is unwilling to utilize preventative services to help them avoid developing some of these chronic conditions. And this is, not because they don't necessarily want to do it. There's a lot of barriers that stand in the way, which I'm sure we'll talk about. But unfortunately, if you aren't taking care of yourself from the very beginning, it's very easy to develop these conditions over time, and then they're very, very hard to treat and reverse, right? So that's something that comes to mind. Another thing that comes to mind is in public health, we talk about something called the social determinants of health. So these are non-medical factors that impact people's health. So these are factors related to poverty, politics, racism, discrimination, violence, food, employment, education, all the factors that shape our lives and how we live our lives and where we live our lives that affect people's health. And unfortunately, for many Latino communities, they don't have access to the best quality of life, and they, are not able to enjoy some of the benefits of these of higher social determinants of health, like the best education, right, or the safest neighborhoods, and that affects their health, right, and it can manifest in some of these chronic conditions that you mentioned. So I want to lift that up from a public health perspective, but I also want to hear what Dr. Nuria has to say from a clinical perspective as well.
So there is definitely a genetic component for Hispanics, and there is an increased incidence of diabetes. And it's not for all Hispanics, it's for certain groups. It's like the increased incidence for Native Americans or Eskimos. There are studies that show that there is an increased risk of developing diabetes for certain groups of Hispanics. But it is true, there are studies too, and that's very interesting, that show that these people that will develop diabetes, if they would have stayed in their cultures and they would have kept their diets and their lifestyle, once they come here and they are exposed to the stress and the difficulties that they have to face when they come here, that's when they develop diabetes, which to me, it's what we should stop, because if they were not going to develop diabetes in their own environment, we should be able to preserve that.
Right, it's
when
preventable.
They come here. Yes.
Right. As a person that was just diagnosed with diabetes,
Yes,
and being Hispanic, it is first of all good to know that there might be a genetic component, but I do know that my lifestyle and some choices that come with it are certainly help me get it, but I'm just still learning. It's been 2.5 weeks since I got that diagnosis, and I fit the mold.
Yes, and What we want to do here is to break the mold. And one of the challenges is access to health care. Despite a lot of progress, Latinos remain nearly 3 times more likely to be uninsured than non-Hispanic whites. The Affordable Care Act has helped narrow the gaps, but the challenges still persist. So how can we improve access to health care for Latinos?
It's interesting because I practiced for 18 years and I see that there is really a barrier for that. And in preparing for this talk, I was reading some articles and I came across some interesting facts. Hispanics are half of the uninsured population in this country, which is, and they are not half of the population of this country, so that's really unfair. And there are some very interesting articles in how Hispanics do very essential jobs in this country. Like they work in construction, they work in agriculture, they work in cleaning, in care of people. But these type of jobs don't give people health insurance, and that is so unfair. So how can we improve that? How can we, if their employers are not giving them the health insurance that they deserve, they need to get it somehow somewhere else. But it is not fair that they are performing jobs that are essential and not getting health insurance.
No, I think that's a huge component of it because, as we all know, healthcare in the United States, you have to, you almost have to pay for your health here, right? And healthcare costs can be exorbitant. And for urgent needs and chronic disease prevention, cancer treatment. It's just, we all know we live that every day. So that's a huge barrier. Another thing that I wanted to lift up too is, for those who are lucky enough to have insurance, or maybe their children have insurance, and they're going to the doctor, there's a lack of culturally competent care, right? There's a lack of Latinos who are, clinicians like Dr. Nuria. And so if it's hard to trust a doctor and develop a relationship with them when they don't speak your language, they're not from your culture, they don't understand your story, they don't hear you, right? And so, or if you have to communicate just through a translator, right? That can be off-putting and affect the quality of your experience when you're seeking care. And that can unfortunately be a deterrent, right? And so I think the quality of the care that is available for Latinos is another thing we want to consider, and how culturally competent and linguistically competent it is too, in addition to, of course, having access to insurance.
That is very interesting because when I was in practice, that's something that I didn't see because I made sure that my patients got everything they needed. But now that I'm with Independence Blue Cross analyzes their data and they do see the gaps in care. They do see that Hispanics lack in some cancer prevention screenings and in certain things. And like you said, now I realize that it's a problem that they don't have the security, the ability to get good health care. They don't trust the system. They might not find a doctor that speaks their language. They don't find someone that's culturally sensitive. And I know at Blue Cross, and I'm glad that they use me a lot for these things to break those gaps and to make sure that we reach the Hispanic population. But this needs to be something wider. We need to really make sure that they have access.
It's so interesting that you touch it because our next question is on cultural barriers. But I do think that, on the other hand, we could also have, in terms of our culture, our access to healthcare might be hindered by an over-trusting of the system. And then when we receive bad healthcare, we just say, okay, this is the way it is. This is we tend to see the doctor as our priest, as our a politician that we just have to listen to what they say, and then we don't question, we don't look for second opinions. How much of that also of our own culture hinders our access to healthcare?
I think that's a very good point. I think one quality of the Hispanic community is how tremendously respectful they are. And I think sometimes that gets in the way because they are respectful and they don't want to bother others. And we need to encourage them to speak up and ask for what they need and for what they want. And you are right. And I think it comes with a good value of being, taking care of the elders, not speaking up to other people and things like that. Hispanics tend to be very nice people in that sense. So they want to speak up for themselves, and they need to.
I think that's such a great point. And also back to the cultural competence aspect, there's actually an infamous case. I don't know if you were around when this happened. It happened, I believe, at Chestnut Hill Hospital, where a Latino man who was very well known as a bomba en plena performer, very well known, very well loved, came in to emergency, and people did not understand him. And so he sat in the waiting room, and he died in the waiting room. And then he was robbed by some patients who were in the waiting room. It was an infamous case and a very sad and tragic case. But it again speaks to the cultural competence, and also perhaps speaking to you about the respect that sometimes people have that isn't always
he did
really
what
helpful.
He was told.
Right, he sat down and waited.
Mm-hmm.
But the wait was fatal in his case. But cultural competence is absolutely critical, as you talked about in terms of diet and how translating from what you were used to in your home country to here, where we're inundated with horrible fast food and preservatives, having that cultural competence is absolutely critical.
Yeah, I think it is. I mean, we don't want to say that necessarily some cultures are healthier than others, right? I think everyone's culture is important. It's an important piece of who you are, and it guides you, and it gives purpose to your life, and it's your identity, which we know is an important piece of people's health, including their mental and emotional health, right? But I think that when Latinos are coming here to this country, there's the push and pull of assimilation into U.S. culture, right? And they feel pressure to do what others are doing, like go to fast food, right? And then there's also things like related to restricted food access for those living in low-income communities and food deserts, where the only thing you have is fast food or a corner market that doesn't have fresh vegetables, right? So there's all these pressures, right? And there's all these constrained choices, right? Not necessarily wanting to make choices that are more unhealthy than others, but maybe being a little bit trapped into it, right? And feeling that pressure. And so, that's culture comes back into play, right? Because there's healthier foods and there's non-healthier foods. But then also, sometimes we just want to eat what we want to eat, what brings us joy and pleasure, and that's okay, right? But, I think it's a complicated process. I don't know what you would think, Dr. Nuria, as well.
It is complicated, but I think there are things that don't help. And for example, the fact that getting a pizza is cheaper than getting fruit or vegetables, that doesn't help. I think that's a big factor. I will always remember when I moved into this country and I went to the supermarket, and they always asked me for coupons. And one day I said, do you have any coupons for vegetables or fruits or, fresh food? No, it's all for canned goods, for chips, for sodas. So those are the things that we can change that don't help. And like you say, we might feel, it's okay to have a soda or to have some chips or to have a snack or to have pizza. But it's not okay that if someone wants to buy vegetables and fruits for their families, they cannot do it because it's cheaper to get something else.
And we will tend to go to the least resistance. But my takeaway today is that I can eat whatever I want, right?
Right, Jose. No. This also brings up the issue of immigration status. And I know that you both, I'm sure, can speak very well to this. Folks who are undocumented are going to be reluctant, I think, to go to the doctor. There might be a lot of fear of deportation, of ICE, and then you have the additional trauma when parents are deported and their kids stay because they're citizens, but their parents are taken back to their home country, and then these children are left to their own devices. What is the impact of immigration on Latino health?
I think it's very timely you bring this up, considering the election cycle now, and President Trump's administration, which he really stepped up immigration enforcement at the U.S.-Mexico border, as we remember, with family separations at the border, and then all across the U.S. ICE, Immigration Customs Enforcement, was pretty much disappearing people off the streets. I worked on a study funded by the National Institutes of Health where we followed families who were separated by parental deportation, and also families who were at risk, but luckily were not separated during the Trump administration. And we collected qualitative interview data and quantitative survey data from these children and their families to understand what are these impacts when a parent is deported or at risk of being deported. And the impacts were extremely profound. Having a parent or primary caregiver deported was a traumatic event for these children and adolescents. And, we saw symptoms of depression, anxiety, somatic issues like headaches, stomach aches, disrupted eating, disruptive sleeping, excessive crying, low academic performance, and then, the family's ability to cope from an economic perspective. These families had to leave their homes. They had to take on longer hours at work. Children in the home had to go to work or take care of younger siblings with a parent missing. I mean, it's a profound impact, taking away someone's parent like that. And so, it worries me, right? Because we saw that happen under Trump the first time, although, deportations, detainments, they weren't new under Trump, right? We've been deporting people from this country for decades under many different presidents. It's just the numbers were a little bit unprecedented. But what I saw, the pain and the trauma from the children, and what I heard from them and their caregivers, and also the parents who were deported to Mexico, who we also followed, just the dissolution of a family is... you can't recover from that, from a health perspective, from a social, political perspective, from an academic perspective, from an economic perspective. It was just terrible to see that. And, I worry about that now, what's going to happen. I think it's just, and many of these children in the study that we conducted, working with the U.S.-Mexico Border Health Commission at Drexel University, were U.S. citizen children who were born here. So they're guaranteed certain rights by law, but by having their parents deported, they were being directly harmed, right? So that's interesting to think about, right? How important is it in this country to have your papers? What does having your papers mean? What protections are you entitled to, right? And what harms are you entitled to be protected from, right? So, I think about them every day, and I think, we can talk a lot more about mental health among Latinos. That's one of them. Documentation status and immigration is definitely related to mental health. So I don't know, Dr. Nuria, do you want to?
But from that perspective, just as you're going to answer, as a clinician, how many times did you ask a patient, show me your papers, if not, I can't help you? So that's an important part to give peace to our listeners. Do they need to be scared of not having their papers to go to the doctor?
They don't need to be scared. They will be accepted anywhere, and no doctor, no hospital, no clinic will turn them away. And that's a safe haven for them. That's definitely something they can count on. They will never be reported or anything. We are just interested in people's health. And I know from the hospitals I worked with and the clinics and everything, that's universal. But I wanted to bring up something else, because I think another problem with immigration, apart from the tragedy of separating children from their parents, even if you don't have an illegal status, and if you are a good immigrant, that you come here, you have a job, it's very difficult because you do not have the family support that you had back in your country. And that creates also a lot of anxiety. I will never forget when I was in residency and I was in my clinic, this poor young lady that had her first baby came to me. The baby was 8 months and she was desperate because this baby, she was breastfeeding every 2 hours. And I said, so what else are you giving the baby? And I said, what do you mean? The baby is 8 months. You should be giving the baby something else. Well, nobody had explained to her that at one point you needed to introduce solids. You need to introduce other things. And if she had been in her country, her mom, her aunt, her grandmother would have told her. But they are here alone, and they don't have that support. And I think that that broke my heart. That, I mean, as a young mother at the time, I was like, it's really hard. And I can see, and I did see this in my practice, that as patients stay in this country, they develop mental health problems. I mean, someone that comes here and doesn't have any problems with time, with pressure, with, sadness, they do develop anxiety, depression, and that's something we need to address too.
Right, which was actually the subject of one of our first Fridays a couple of months ago.
And not only that, they are reading our minds, because that is the subject of our next question, mental health.
Right, exactly.
Yes.
Why don't you ask the question?
Well, absolutely. And in a way, it has been addressed. The longer a Latino or Latina resides in the U.S., the more likely they are to experience mental health problems. What factors contribute to this trend, and how can we provide better mental health support?
So I think one factor is the lack of support. And that's why I think it's very important for Latinos when they come here to get together and to get close to their roots. And I think sometimes one of the things that I saw helped my patients a lot was their religious affiliation. I mean, and that might seem like something strange, but I think it's very important, because if you don't have your family, but you have your community, that will help you. So that's something that sometimes can help.
I think another factor at play here in terms of mental health for Latinos is, thinking about where Latinos are living and what communities are living in. Unfortunately, these are generally communities where there's lower investment. They're communities of color, and what happens in communities of color these days is a lot of community violence, gun violence, disruption on the streets. And, over time, whether or not you are directly involved with an act of violence in your neighborhood, the body keeps count. It takes a toll, and these young people are witnessing things happening in their neighborhoods, and over time it just breaks down their mental and emotional spirit, and then affects their psychological health, right? So I think it's tough. Sometimes it's tough out there, and the Latinos and the Latino community are tough as well, but at what cost and at what point, right? And someone can only take so much, right? And then if you don't have support or your community, or even if you do have that, but you feel like your community is under attack, and you're not able to get out, you're not able to improve yourself, improve the life of yourself and your children, that contributes to your allostatic load, right? The amount of stress that you're taking on over time, and that takes a toll. And it can manifest in many different conditions, including mental emotional health, but then also physiological conditions, cardiovascular conditions. So I think that's another piece I wanted to lift up as well.
And we are going to go back to your diabetes, because you have probably been told that you need to exercise. So, we know how important exercise is for your both physical and mental health. And it's interesting what you say, because I remember when I started practicing in North Philadelphia, I was talking to a lady and I said, I don't tell my patients, you don't have to go to the gym, you don't have to do anything extreme, you can just go for a walk. And she looked at me and she was like, where am I going to go for a walk? Am I gonna get shot when I go outside? So it is true. That is a problem, because something that could be as easy as going for a walk, it's not as easy for everybody. And so where they live, it really influences the ability they have to be physically active and to do the things they need to do. And then, because so many years in practice, sometimes you say, well, you take your car. Well, who has a car? Not everybody has a car. What public transportation do we have? Do they have access to go to places that are safe and that they can go without any problem? So those are things to think about.
Well,
I would have to say, since it was singled out, it's not just, even if you do have the public transportation, exercising is already a toll. And if you have to get on a bus, if you have to go through other steps in order to get to the place where you can walk, guess what? It's the first thing that you're going to toss aside. But interestingly, we didn't talk about the fact that most of us live paycheck to paycheck, which is also a stressful situation. The access to good jobs. What percentage of your Hispanic patients, the people that you serve, are living a lifestyle that does not include stress for money, financial stress?
Unfortunately, that's true. And like we were saying before, because the type of jobs that they normally get don't pay well, don't give health insurance, don't have benefits. It's one job to the next job to the next job. And if you don't work, you don't get paid. And we need to make sure that those things don't happen. But going back to your exercise, one thing that we Latinos like to do is dancing. That's a great exercise.
Yeah.
Well, that's so.
I don't know why I have
you know,
diabetes.
you see, there are no excuses not to exercise. I used to tell my patients, just dance. I mean,
See, I don't know why I have diabetes, Loraine. It's a conspiracy.
Yeah, if dancing would cure your diabetes, you would be totally, because this man can
100%.
dance.
Oh, thank you.
Unfortunately, we've come close to the end of our time, but I wanted to give both of you the opportunity to share with us the resources that you bring to bear that people might be able to take advantage of. I know Esperanza has a lot of resources, and so does Independence Blue Cross. So we'll begin with you.
Sure. So, I work for Nueva Esperanza Incorporated, or also known as Esperanza, in North Philadelphia, serving the Hunting Park, Feltonville, and Juniata neighborhoods of Philly. We are a faith-based, multi-service nonprofit organization. We don't do direct health care service delivery, like Independence Blue Cross. Our friends down the road at Esperanza Health Center, which is a different organization, they do direct health care. But we have a lot of expanded programs around education, advocacy, linking people to resources, community organizing and engagement, and then working to improve and revitalize the neighborhoods in our commercial corridors as well. We have several charter schools and then a cyber school serving thousands of children and their families. We have a community arts theater and a music school. We have a career link to get people jobs, because we understand that's very important. We do housing counseling. We work directly with faith-based organizations and congregations in our neighborhood, because faith is very important to Esperanza, and also, as you know, it's important to people's health and well-being. We just are out in the community, out in the streets, doing food distribution, making sure people know what programs are open to them. And all of this is done, in a bilingual way, because we are especially committed to supporting Hispanic Latinos in our neighborhood, although any residents are welcome to come through our doors. Yeah, sure. You can go to esperanza.us. That's our website. I don't remember the phone number off the top of my head, but I can definitely get that to you. Or it's on, it's on my card somewhere. Yeah, it would be on the website. Yeah, check us out. We have a lot of programs going on. I oversee the community engagement piece, and we do a lot of work around environmental justice. That's also related to health, planting trees, making sure there's green space for people to exercise in, community gardens to grow healthier food. We're trying to do it all, I think. And, you can't always do it all, but we hope at Esperanza, we have hope that we can do that. So check us out. There's a lot of resources available to any and all, but especially Hispanic Latinos.
So in IBC, we are really committed to closing that gap in healthcare outcomes. And I know we cannot provide as many things as your organization, but one thing that I want to make sure everybody understands too is that IBC is very committed and it's very proactive, but every organization in this country that provides healthcare is mandatory for them to provide care in the language that you require. There are language lines, there are, interpreters. So don't be afraid. If you do not speak the language, you can get help. It's mandatory. If you go to a place and then don't provide care in your language, that's something that shouldn't be. That's something that you can get anywhere. And in ibx.org, you can find our programs. And if you call and you ask to speak in Spanish, someone will speak to you in Spanish. You can get your case management in Spanish. You can get help in Spanish too.
Fantastic. Well, we want to thank the both of you for joining us here today to have this very important conversation about Latinos in healthcare. Dr. Nuria Lopez-Pajares, Independence Blue Cross Medical Director and Board-Certified Preventive Medicine Physician for Independence Blue Cross. Jamile Tellez Lieberman, who is Senior Vice President for Community Engagement, Research, and Health Equity for Esperanza. I'm Loraine Ballard Morrill.
I am Jose Urdaneta, and I would like to invite you to join the conversation every first Friday here with us, online, on the radio, and wherever we can reach you.
Gracias.